Once the graft is positioned into your knee, your wounds are closed with sutures and a dressing is placed on the skin. After surgery, you will feel some pain and discomfort up the back of your thigh and behind your knee. This is where the hamstring was harvested from. You will also have some discomfort and swelling in your knee. However, the majority of patients are not in extreme pain, even shortly after surgery. You are allowed to get up and mobilise on your knee as soon as you feel comfortable. You can put as much weight through it as you like, but most patients will need to use crutches for 3 to 7 days until they can safely walk without them. Your physiotherapist will guide this process. I recommend 2 weeks off work for most patients. You may be able to return to light office-based duties within 1 week, but 2 weeks is more realistic. Even though this is a keyhole procedure, it is a significant operation, and you will have pain and swelling, especially if you spend long periods of time on your feet. You could drive a car within 1 to 2 weeks, depending on your pain and swelling, and also which leg you have had surgery on. During your hospital visit, you'll be seen by a sports physiotherapist, and they will get you started with a 2-week rehabilitation program by showing you exercises that you should perform at least 3 times per day. I cannot overemphasize enough how important rehabilitation is when recovering from ACL reconstruction. Patients who do not put in a regular effort, overseen by an experienced sports physiotherapist, can expect much poorer results. Full ACL rehabilitation takes a minimum of 12 months, and maintaining a regular injury prevention program with your physiotherapist is also highly recommended, even after your initial rehabilitation program is finished. Swelling can persist within your knee for several months. Remember that it takes 12 months for that graft to fully heal inside your knee. And your knee is also recovering from a very large injury. You absolutely must book an appointment to see your own physiotherapist within 1 to 2 weeks of leaving hospital. If you don't already have a physiotherapist, I can certainly recommend one. It makes sense to see a physiotherapist who is close to where you live or work. Otherwise, you'll be less inclined to see them regularly. Good ACL rehabilitation is not time-focused, it is goal-focused. We don't accelerate your rehabilitation purely according to how long it has been since your surgery. You progress based on achieving goals. These might include range of motion, swelling reduction, or strength improvement, for example. I'll provide your physiotherapist with a basic rehabilitation protocol, and they will use this along with their preferences and experience to take you through a 12-month rehabilitation program. Whilst there is variation in rehabilitation, I can give you a basic outline of progression that should apply to most patients. By 2 weeks, you should be walking without crutches, but you may still have a limp. You can also cycle on an exercise trainer as soon as your knee has sufficient bending. By 6 weeks, you should have full range of motion, reduced swelling, and walking without a major limp. By 3 months, you can start jogging gently in a straight line. At 6 months, some supervised jumping, landing, and leaping can begin. At 9 months, you can commence some sport-specific training, which means doing some of the activities of your chosen sport, but in a non-contact environment. From 9 to 12 months, your training and activities will gradually progress, with the aim of returning to full sports by about 12 months after surgery. In my practice, I do see and treat ACL injuries amongst elite athletes in the AFL, AFLW and the NBL. However, the bulk of my patients with ACL injuries are what I would call weekend warriors. Regular, everyday people that enjoy getting out and playing some sport on the weekends or just keeping fit and active. Because I perform a high volume of ACL surgery, I keep appointments free and available every day, only for patients with ACL injuries. So if you would like to be seen quickly, I can usually accommodate that within a few days. If you do have further questions or you'd like to make an appointment, please give me a call in my rooms at any time.